We have decided to do our 2-minute pitch on the case Baby Euthanasia.
This case is about a baby born with an extremely rare and incurable illness, a terminal metabolic disorder. She was only given 30 months to live as she suffered around the clock. Her parents said that they tried all sorts of things and felt terrible watching her suffer. She would throw up milk that was fed to her through her nose. Doctors agreed to help the baby die at 7 months old. The director of pediatrics in Holland explained that active ending of life can be an option if there is an unbearable suffering and untreatable disease. Our position in this situation is that euthanasia is morally correct and therefore should be legalized.
This is our entire argument, but we're going to break it down for you guys.
Concerning the patient, a physician can assume prolonged health and life is a top priority. Some patients value their life of quality, so some would prefer having a shorter life with a better quality. Therefore, physicians can assume patients value orderings. Physicians have a duty of beneficence. Therefore, a physician's highest priority should be relieving or preventing pain and suffering to promote the well-being of others. For the suffering baby, the only way to relieve the pain was through euthanasia, as her terminal illness had no cure, no other treatment options. Had the suffering baby not had gone through euthanasia, this would have contradicted with the physician's duty of beneficence. Therefore, euthanasia to promote beneficence on a person should be permissible.
Right actions are those that cause happiness or take away pain. Wrong if they do the opposite. We as people have the duty to promote the utility for everyone involved. Therefore, a physician should maximize the utility for the patient and everyone affected. Looking at the greater overall well-being of the ones involved, regardless of moral rules and principles, is necessary to maximize the utility. The baby was always crying in pain, and the mother stated her and her husband felt terrible watching her suffer. After euthanasia was performed, the baby was no longer in pain, and Anita said she felt at peace knowing that. Frank said it was a long road to find the solution, but decided that this is what they wanted. Therefore, euthanasia should be permissible for the utility of both the patient and the family.
Letting someone die when there is something you can do to prevent it is the deliberate killing of someone. Therefore, disregarding life-sustaining treatment is the deliberate killing of a person. However, disregarding life-sustaining treatment can be justified when the person is severely suffering, has a terminal illness, and is therefore nothing else medically possible to help the person. The baby in this case was diagnosed with a terminal illness and only given 30 months to live, and she was suffering around the clock. Therefore, the deliberate killing of the baby is justified. Euthanasia is the deliberate killing of a person. Therefore, euthanasia is not always wrong.
Euthanasia to promote beneficence on a person should be permissible. Euthanasia should be permissible for the utility of both the patient and their family. Euthanasia is not always wrong. For these 3 reasons, in this situation, euthanasia was morally correct and therefore should be legalized.